Hi everyone, my name is Manna Semby. I am a naturopathic doctor at the Center for New Medicine in Irvine. Today I want to talk about heart health and how to prevent heart disease and keep your heart healthy. Now, all of you have heard a lot about how you can keep your heart healthy, things like um, eat a good diet, reduce the stress, get good sleep, exercise. So all these things are factors that you already know about. What I want to talk about today is how, as naturopathic doctors, do we team up with patients to help you keep heart disease at bay. And I want to talk about what we look at, how we monitor, how we help you stay on top of your heart health. What I want to do today is go off of the some of the points collected by a naturopathic doctor who's the first naturopathic cardiologist, Dr. Decker Weiss, and some of the pointers that he put together. So I want to take you through those today, and there are 7 of them. So let's get started. Okay, so the first step out of the 7 steps that we as naturopathic doctors go through when we are helping a patient with maintaining heart health, the first thing we do is make sure that there is a proper intake. Okay, a proper intake means things like monitoring if you're taking any non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, if you're taking any acid blockers like PPIs, proton pump inhibitors. Those 2 categories of drugs have been shown to have a direct negative effect on your health overall and your heart health in particular. So we really have to look into why you need to take those NSAIDs and PPIs. And what we are looking for is different kinds of inflammation in your body. Okay, so the NSAIDs you're taking for pain and inflammation, we need to see what's the source of that. Is there joint pain? Is there insomnia? Is there depression? Is there fatigue? Is there acidity, bloating? All these different things that seem unrelated to heart health are actually the first few pointers that something is wrong. Our job in it is really to be an inflammation hunter. We want to look to see, is there inflammation in your body? Where could it be coming from? And zero in on that. So if you have insomnia, depression, fatigue, joint pain, as I mentioned, we want to see what's happening with that and do specific tests to figure out what is the cause and how we can address that inflammation without putting you even on over-the-counter drugs. The second step is fixing the GI tract or the gastrointestinal tract. Now, the GI tract runs all the way from your mouth through your body and all the way out your anus. So mouth to anus, the entire GI tract, you want to make sure that it's healthy, intact, and it has what it needs in different parts of the body. For instance, your stomach needs to be acidic, so the pH needs to be acidic, below 7.2 or so. So you need to be in the 4 to 5 range, and your intestines need to be alkaline. So, and your mouth needs to be healthy. If you have dental issues, periodontal disease, gingivitis, that has been very clearly associated with heart disease. So you want to make sure you're taking care of your mouth. And then through your body, your stomach is acidic enough so that you're able to break down and digest all the proteins, and your intestines, again, have the right pH. You also want to make sure that you do not have constipation, that you do not have leaky gut, that you're taking the probiotic that is right for you. For instance, there is a study that shows there is a direct correlation between gut flora as to what is the whole microbiome in the gut that you have and cardiovascular disease. And there's a particular strain of probiotics that helps to keep that in balance. So we look at what's happening in your body and see which probiotic is better for you and give you that. The other thing is, which is very widely known, is that obesity is a very big risk factor for atherosclerosis, part of cardiovascular disease. So what happens is that obese patients are not only carrying the extra weight, but they're also generally experiencing gut dysbiosis. So we need to fix that. That's another symptom: constipation, high blood pressure, and gut dysbiosis are things that we need to look into as some of the early indicators of cardiovascular disease. So you want to be looking at any early markers, any indicators, any symptoms that you have that may point to heart disease down the road. By the time you have chest pain, we kind of have missed all the early signs, and now we're in the later stages. So we want to avoid that. Point number 3, we need to be concerned about the health of your endothelium. Endothelium is the innermost layer of blood vessels. It's one cell thick, so it's very delicate, and we need to ensure that your endothelium is as healthy as possible, because if you have a family history of heart disease, if you have high blood pressure, if you're over 40 and you have these indications, we can say that there is some level of endothelial dysfunction. And what happens when there is endothelial dysfunction is that atheromas or plaque begins to form between the innermost layer of the blood vessel and the medium layer. And so not only is there plaque over there, but the lumen or the opening of the blood vessels begins to get smaller. And then it becomes a vicious cycle. Your blood pressure is going to get higher, a piece of the plaque can break off, become a clot, and cause a heart attack that way. So you want to make sure that you're doing what you can to preserve the health of your endothelium. Now, how do we do this? As naturopathic doctors, we love our plant and botanical medicine. There are herbs like crataegus that can be really helpful to maintain the health of your endothelium. And there are other things like Philanthus emblica, another herb, and things like alpha lipoic acid that can be very helpful. So making sure that we are putting you on the right kind of supplements that can help you prevent either the beginning of heart disease or prevent the worsening of any of these problems. Number 4 on our list is doing the appropriate tests, which means we are not just going to look at the lipid panel because that's just the basic, that's just the starting point. We want to look at a few other markers as well to see if there is inflammation, if there is an increase in some of these markers that can tell us where the problem might be lurking. This would include, as I said, not just the lipid panel. Of course, we would have your LDL cholesterol, your small dense LDL cholesterol. We would have your ApoB, ApoA, the ratio between those two. We would look at indicators like myeloperoxidase, heart-sensitive CRP. We would look at your autoimmune markers like ANA or double-stranded DNA. So we would look at a wide variety of markers to get a full picture of what your body is telling us. Also, if patients have conditions like insomnia or hormone dysregulation or mild to moderate depression, we might look at their neurotransmitters as well, because some neurotransmitters like serotonin, if you are low on those, it can also cause endothelial dysfunction. So depending on what are the symptoms that are presenting in your case, we might do a wide variety of tests to get a good handle on things. Number 5, we want to make sure that we are managing your fluids. If there is any extra fluid buildup in your body, if there is edema, we don't want to not use the drugs that can help us, whether it is diuretics or other drugs like beta blockers or ACE inhibitors. If we need to use them, we will use them, but we want to see what is the cause, where is it coming from, and if we can address that directly. So we will look at your diet. We will look at maybe you need to do some fasting or intermittent fasting or a different kind of diet that might help you. We also want to manage your blood sugar and A1C. Now, what a lot of people don't understand, and this is really critical, and new science is coming out every day on this, which is that blood sugar and A1C are not the first indicators of conditions like prediabetes and diabetes. They are simply indicators that your body has become insulin resistant. So what we need to be checking is your insulin resistance even before you have indications of high blood sugar and A1C, to see if your body is producing higher amounts of insulin. Because the more insulin you have in your body, the more the downstream effects it'll have. It'll cause, in many cases, it is the first cause or primary cause of high blood pressure. It can lead to worsening in tumor formation and other things like that. So we want to make sure we manage your insulin, your blood sugar, and your A1C, and we do the best that we can to manage your edema if there is any. And keeping with the theme of reducing inflammation and healing your gut, we may also suggest things like detoxes. We may suggest a liver detox, a lymph detox, a colon detox. All these things will help to remove the toxins from various parts of the body and make sure the functioning is smooth and without any glitches. Number 6, keep moving, or really exercise is critical. We all know that we need to stand more than sit, walk more than just stand. So we need to just make sure that we are moving every day, at least 30 minutes of moderate to brisk walking every day is needed. You want to make sure you get your heart rate up and pumping a few times a week. Many times, Dr. Decker-Weiss likes to suggest martial arts for people that are over 50. They can be very interesting. You're learning a new skill, a new art, and also you're doing this with a group of people, COVID notwithstanding. But any kind of exercise, if you like, swimming, dancing, aerobics, cycling, Peloton, whatever it is that gets you interested and moving, make sure you're doing that. Exercise is really key to making sure that not only your lymph and your blood flow, your circulation are going well, but that your blood vessels are healthy, and all your whole body is getting perfused with a good amount of blood all the time. Last but not least, number 7. No talk on heart health can be complete without talking about food. So we want to make sure that you are eating right, eat organic to the extent possible. Try not to make choices that are junk food or not wholesome food. And you want to make sure that you understand that your lymph is connected to your immune tissue, okay? And that is part of the inflammatory cycle. If you have any questions or comments, you are welcome to leave them below, and we will get back to you. Thank you.